Yes, sir.
Meeting just got
Yes.
over a minute
Yes.
back.
Ma'am, we are live in YouTube also now.
Yes, I'll start.
Ma'am, come in center.
Okay.
Yes.
प्रवीण तो मोबाईल शेअर करायचा आहे का SymbiCare ची स्क्रीन वाला
हो करा करा.
एकच
Good afternoon, students, and welcome to the SymbiCare induction program. For the last 2 years, the entire world has been facing a health challenge. Probably, this could be called the longest pandemic in human history. But then, every cloud has a silver lining. COVID has taught us to lead our lives with a new normal. It has broadened our perspectives, made us more empathetic as human beings, and also more innovative as teachers and students. Symbiosis, as a health promoting university, has done its best in this challenging period by supporting its students and staff with the help of SymbiCare. To throw more light on the values of Symbiosis as a health promoting university and to share with you this beautiful concept of SymbiCare, I invite today's chairperson, Dr. Rajiv Yeravadekar, Dean, Faculty of Health Sciences, to address the students.
Good afternoon, everyone. Am I audible?
Yes, sir.
Yeah. So welcome, dear students. And as Professor Vaishali rightly mentioned, today is more a world of virtual reality in that sense. And as rightly commissioned, or rather nomenclatured by none other than Professor at Stanford, the Dean of the Faculty of Management, Professor Shrikant Datar, we are living in a world of what he terms as VUCA, VUCA, where V stands for volatility, U stands for uncertainty, C stands for complexity, and A stands for ambiguity. Be that as it may be, in this world of VUCA, technology comes to our rescue, and instead of a physical connect, we have a virtual connect, whether it's lectures, whether it's seminars, whether it's even these informal meetings where we talk to you about new initiatives undertaken by Symbiosis International University, and as rightly mentioned by Professor Vaishali, we are a health promoting university. And what do I mean by a health promoting university? Wherein we try to ingrain health and well-being of our stakeholders, predominantly first you, the students, who are the VIP on campus, as mentioned by none other than our Honorable Chancellor, Professor Dr. Muzumdar. Then is the faculty, the non-teaching faculty included, as well as the alumni who continue to be associated with the university. And finally, the civil society, the community which is close to our university. The fact that we've adopted 22 villages as part of our outreach initiatives under the Symbiosis Community Outreach Program and Extension, acronymized as SCOPE, Symbiosis Community Outreach Program Extension. We do try to reach out towards community empowerment and engaging. And at the Faculty of Health Sciences, well, as a university, we thought that the best way to empower the community was through education, which is our mainstream focus as a university. But we also thought that the second or equally important parameter of associating with the university, with the community, would be healthcare. And so education and healthcare have been two chosen vehicles by the university in connecting with the community. And coming back to the in-house community of the staff and students, the team of healthcare professionals at the Faculty of Health Sciences, whether it's Dr. Alka Chandak, who heads the Symbiosis Center of Healthcare, which was established as the first seed way back on 14 June 1997 as the first unit of the healthcare, of the footprint of Symbiosis in the sector of healthcare, by providing on-campus preventive, promotive, and curative healthcare services on campus to staff and students, followed by the Symbiosis Institute of Health Sciences, which was commissioned to indulge in capacity building initiatives, whether it's in the healthcare management, whether it's in the public health, whether in the nutrition and dietetics department, followed by the Symbiosis College of Nursing, which provides the all-important, and I would use the word all-important with deliberate intent, of highlight the importance of nurses who contribute to efficient and optimum healthcare delivery. Whether it comes to the School of Sports Sciences, which albeit the fact runs a management program in sports management, but contributes more importantly through the Department of Sports, Recreation and Wellness, headed by Shweta, under guidance of Dr. Naina, who heads the Symbiosis School of Sports Sciences, to provide recreational and wellness facilities for the students and staff on campus. Or for that matter, the two more recent entrants way back in 2018, and I say way back because today we sit in 2022, so it's four years down backyard, where Dr. Girija Mahale was requested to set up the Symbiosis Center for Emotional Wellbeing to address the mental health issues of stakeholders on campus. And perhaps the inflection point or the crowning jewel in our entire crown of institutions at the Faculty of Health Sciences was the establishment of the Symbiosis Medical College for Women. And more importantly to the common man is the establishment of the Symbiosis University Hospital and Research Center to provide tertiary care services to the staff and students of Symbiosis and the community at large. So when we as stakeholders or self-proclaimed guardians of healthcare services, academics at the university talk about what are we doing, whether it's Alka, whether it's Dr. Natarajan who heads the Symbiosis University of Health Science, University Hospital and Research Center, whether it's Dr. Kavita who leads the nutrition and dietetic services, whether it's Dr. Raghu who communicates with the community at large, along with Dr. Palve for the public health initiatives, whether it is Girija, as I said, who speaks about mental health. We all thought that to make these services known to the students who are freshmen, who are fresh entrants into the Symbiosis family, initially we talked about having a newsletter, and it was very promptly and rightly shot down by all stakeholders. They say that, Rajiv, today's generation is Gen Next, which is more tech savvy, and they would always like something which is easy, accessible, and in the comfort of their hands, and therefore emerged an app which is loaded which can be easily loaded onto your mobile, which gives you a ready reference of what all these institutions under the Faculty of Health Sciences provide by way of healthcare services in the realm of physical health, mental health, social health, spiritual health, and everything which will help you to remain in a state of health and well-being to pursue your academics towards ultimate attainment of what we say as the vision for which you enroll in a university, to get quality education, to get quality training, and to emerge as responsible global citizens. Because we do understand that as a part of a domino effect, one aspect of your student's life impacts and collides everything, whether it's financial, whether it's relationships, whether it's academics, whether it is healthcare. And there are so many influences on you, most importantly of which we rate as the peer influence. Having moved away from the confines of the tender loving care of your parents, you are exposed to a new world. And that's the time where you are likely to indulge in risk-related behavior. And mind you, at this stage, I would like to get to your attention that as healthcare providers, we don't want to be moral police. We don't want to be telling you what is good or bad necessarily always alone, but importantly tell you and make you party to an informed decision, an informed act which you would like to indulge by way of your choices at this young, tender, and thereby a vulnerable age. So welcome to the Symbiosis family, and I request my colleagues in the Faculty of Health Sciences to take the proceedings forward. Thank you, Professor Vaishali, for inviting me and asking me to set the context and the tone of the presentations for the SymbiCare mobile app. Thank you so much.
Thank you, sir. Thank you very much for your enlightening words and such good thoughts about Symbiosis and the motto that we follow so religiously. Thank you. So, dear students, now I would like to introduce you to the 5 department heads who make the SymbiCare team. Praveen sir, please start the presentation. Thank you. So the SymbiCare is a combination of 5 departments, and let us run through the next slide, please. These departments are Department of Student Affairs, Department of Sport, Recreation and Wellness, Symbiosis Center for Healthcare, Symbiosis Center of Emotional Wellbeing, and the Symbiosis University Hospital and Research Center. Okay, this is me, Dr. Vaishali Zunre. I head the Student Affairs. The next slide, please. This is the team of Student Affairs Department. Ms. Supriya Kutty, who is the section officer, Mr. Milind Joshi, who is the senior coordinator, and Mr. Dhairyashil Jagdai, supervisor administration department, who takes care of the scholarships. Under the Department of Sports, Recreation and Wellness, okay, this is. Yeah. Okay. We have Ms. Shweta Sharma, who is the head of Recreation and Wellness Center. However, the Department of Sports, Recreation and Wellness is headed by Dr. Naina Ninkar. And the team that she supported is Mr. Anthony Augustine, Ms. Beluvar Kulaj, Mr. Nirmal Michael Salvi, and Mr. Wasim Khan. The next, Dr. Alka Chandak, who is the director of the Symbiosis Center of Healthcare, is supported with her team. Okay. I'm sorry, but this is not the right PPT. Anyway, I'll move on to the next head of the Symbiosis Center for Emotional Wellbeing, Dr. Girija Mahale. Students, I'll be happy to tell you that every campus of Symbiosis is supported with a consultant, a counselor, who helps you to manage yourself mentally and maintain your mental health. The next one, please. Yeah. The last but not the least, Dr. Vijay Natarajan, who is the CEO of the Symbiosis University Hospital and Research Center. I will be inviting all these heads of the departments and deans to make their presentations to introduce you to all the functions that we do under the SymbiCare app. So first, I would like to invite Dr. Alka Chandak to make her presentation.
Good afternoon, all my dear students and all the heads of all different institutes under Symbiosis International University. As already addressed by Rajiv sir, due to COVID, we are not meeting physically and physically every students to share our services which are actually established for Symbiosis students and staff members. Mujumdar sir always says now due to COVID, such a beautiful infrastructure which is for Symbiosis staff and students, this is a garden without flower. And it is so truly said by Mujumdar sir. I would like to share our vision and mission for Symbiosis Center of Healthcare. The team of healthcare professionals are working towards to promote the health and wellness amongst students and staff and community at large. And we have the vision of creating a state of positive health in the community at large. My request to the IT team, if with this vision and mission, if you will share the film with all my students, it would be easy for everyone to understand the facilities. And then I will again connect with them. So please share the film.
Significant things have humble beginnings. A young girl was spotted in the boys' hostel, stealthily passing something through a window. The professor of botany and warden of the boys' hostel, who noticed this at first, assumed the worst. Instead, he discovered that a Mauritian girl was passing homemade food to her brother who had jaundice. Stunned by this discovery, the rector decided that something must be done to help the international student community, especially in a country known for its hospitality. Based on the belief that the world is one family, an international students' hostel was started on the 26th of January 1971. It was called Symbiosis, a botanical term meaning living together for mutual benefit. The same rector, Dr. S.B. Mujumdar, became the founder director. Under the dynamic leadership of Dr. Mujumdar, Symbiosis today has blossomed from a small international students' hostel to India's premier university, with about 50 institutions offering around 200 different academic courses to almost 50,000 regular students, including more than 2,000 international students. And Symbiosis realizes that for academic success, good health is imperative.
The Symbiosis Center of Healthcare was established in 1997. Before that, Rajiv and I worked with the Ministry of Health Sultanate of Oman. And while we were working, we realized that there was a lot of emphasis on health education, school healthcare, university and college healthcare activities for students. And we felt that why not bring all this to India? But India was a large country for us to even think of doing anything for. And therefore, we felt that let's do something for the population of Symbiosis.
So the Symbiosis Center of Healthcare has been established on all campuses with the objective of providing healthcare services to the staff and the students and the community at large also. The entire range of healthcare professionals are made available to the students and staff to address their healthcare problems on campus. We also have ultra-modern, state-of-the-art recreation and wellness facilities to provide the much-needed respite from the academic rigors. The entire objective is to establish Symbiosis truly as a health-promoting university.
Under the umbrella of Preventive Healthcare Services, Symbiosis Center of Healthcare, or SCHC, conducts a health and wellness checkup for students and staff of Symbiosis every year. The objective of this annual wellness checkup is to assess your health, nutrition, fitness, and wellness status. Consultants and specialists from different disciplines such as physician, ophthalmologist, ENT specialist, dentist, and pathologist, as well as a certified wellness professional, conduct your annual wellness checkup. An electronic health record is created and maintained for future reference. The wellness evaluation done at the Recreation and Wellness Center assesses you for strength, stamina, and suppleness by various simple but internationally accepted tests and norms. SCHC also provides curative healthcare services to the students and staff members of the Symbiosis family, such as dental OPD, eye OPD, ENT OPD, physician OPD, and counseling services, including diet, physiotherapy, and mental health. In the unfortunate event that a student needs to be hospitalized, the center provides a unique medical insurance scheme. The students can avail medicine, doctor's advice, and hospitalization anywhere in the country.
जब मैं अपने फ्रेंड्स के साथ पार्टी से आ रहा था तो ब्लू डायमंड होटल के पास स्कूटर का एक्सीडेंट हो गया.
5th of March in the morning, I received a call that he met with an accident. In between, I received a call from Dr. Rajiv from Symbiosis Center for Healthcare. He said that don't worry, he's sick.
I know that the student has come from Symbiosis. I really don't have to worry. I really don't have to wait for anybody to take the responsibility, and I can do the best of medical treatment for the needy person.
Under the promotive healthcare services, the campus health advisory committees have been constituted at all campuses to look into diverse health aspects of students and to review communication strategies to stakeholders on health matters. SCHC has been organizing health awareness sessions for students of Symbiosis and the community at large to promote health literacy. Initiatives, innovations, and selfless service. These qualities have made SCHC go beyond the role of providing support services. As we say in Symbiosis, a doctor in need is a friend indeed.
So after looking at the film, I would like to request all students to please download SymbiCare mobile application. Few students might have downloaded also, which is available on Google Play and iOS platform. And all the services just now, which Rajiv sir explained, which we have incorporated in the film, it's in a very simple language. It is available in the SymbiCare mobile application. And all these departments' detailed information is also available. Now, how to use this mobile application as regards healthcare services is concerned. So if you will go to HCHC, Symbiosis Center of Healthcare, and the specific campus, as our presence is pan-India, you can go to the campus and you will see the medical officer's mobile number, which are emergency medical services number, wherein you can ask for any help. If you will click that number, it's a hotline, you will directly connect with medical officer. So my request to everyone, please download SymbiCare mobile application. After using the application, you are free to give any feedback about application as well as the services which you are accessing, whether it's online or whether it is in person, as and when we will again reopen the campus when everyone is fully vaccinated. My request to everyone, I think so many students have already taken the vaccine. If you are still pending, please take your second vaccination dose. And those who are in Pune, they can access our SUHRC, which Dr. Natarajan sir is going to address in detail. But please do your vaccination complete. Now, as already explained in the film, we are providing preventive, promotive, and curative healthcare services. With these services, we have established one indicator as regards health is concerned as health promoting university, which we call outcome matrix performance indicator, wherein the services are there, but whether the students are using it or not is very important for us. So we have established indicator. First indicator is if all students are attending campus health and wellness committee. So every institute faculty member as well as 2 students, 1 girl and 1 boy. So the student representative, faculty members, doctors from campus, fitness professional from campus, they are a part of that team, which is under the chairmanship of campus administrator. And there you are being a representative of student community. You can voice your opinion about the services. You can give inputs, what improvements can be made into the system. But attendance to campus health and wellness committee is one parameter wherein that institute will get a rating about the services provided by health center and used by the students. So first indicator is attendance of student representative in campus health and wellness committee. The second indicator is health education program. We are conducting 2 health education program per semester. I do understand due to COVID, we are not meeting in person, but online sessions are conducted to spread the health awareness and promote the positive health amongst students and staff members of Symbiosis. The objective is actually to impart the knowledge to create positive health, and we are focusing on disease prevention. So my request to all students, please attend this 2 health education program per semester. So total 4 health education program arranged by Symbiosis Center of Healthcare. So that is the second indicator, attendance to health education program. Third indicator is registration to health insurance. Every student is medically insured for 50,000 rupees of mediclaim and 1 lakh rupees for road traffic accident. We don't want actually to use these services, but if any unfortunate event, if someone is hospitalized, yes, we are there for affordable healthcare. So what you are expected to do, you are requested to connect with your admin officer of your institute and ensure whether your personal details are entered into the system. Through that system, the data flows to the national insurance company, and as and when hospitalization is required, the team HCHC is activated to provide the healthcare, and we do take care of your bills, either it is cashless or it is reimbursement. In Pune, obviously, as we have our hospital, you are admitted in our hospital, and pan India, the respective hospital which are convenient to you and which is empaneled on national insurance company for cashless claim. The third indicator I have explained about registration. So the responsibility lies with the student. Please ensure with your admin officer about your personal details they submitted or not. And the fourth indicator as regards health is concerned, that is attendance to annual wellness checkup. Yes, we do understand, as we all are working till date online. So as and when you will come on campus, yes, we are there to conduct the checkup and screen your health and fitness parameters to achieve your well-being. So these 4 indicators are very important. I think if anyone does have any query, feel free to go to the SymbiCare mobile application, click the feedback, and please give your feedback, which is very important for us for continuous improvement. Now, my next request to every student, as Symbiosis International University is health promoting university, we team of healthcare professionals under Symbiosis College of Symbiosis Medical College and Symbiosis Hospital, we have in association with HCHC, we have designed one program, COVID Care for Community Health, which is available online. If you will go to HCHC website, you can see that under academics, the program details are there. It is 1 credit, means 15-hour health education program. And after passing, we do assess the student whether they have understood or not, because still COVID is there. So, and which is mandatory program. So my request to everyone, please access that website, and it is a synchronous way of learning. Experts from our hospital, they have designed it. So please understand how they are explaining. And I think Symbi crowd is very smart. So students knows actually now more than the faculty, and I do understand, but to get that certificate of 1 credit, which is very important, please go through that program. And I am happy to share 21,000 students of Symbiosis, they have completed the program pan India. And I would like to appreciate the Symbiosis students because they are very keen to take care of their health, and they are also aware, because without students, we cannot say we are health promoting university. So students are the king on campus, frankly speaking, which we are not meeting in person, but we all healthcare professionals, as regards preventive care is required, it's concerned, we are waiting when campuses are going to open, and we will meet our students on regular basis and just see how the students are roaming here, and campus will have absolutely vibrant atmosphere. My all doctors are waiting to meet the students. So that is related to COVID care for community health. And I already shared the feedback. So please give the feedback for all services, whether it is health education program, whether it is insurance, or whether it is campus health and wellness committee. Feel free to give the feedback. We are there to serve you as regards healthcare services are concerned. And my team of healthcare professionals, they are waiting for your feedback. And we work towards continuous improvement in the system. at Symbiosis Center of Healthcare. Thank you so much, Dr. Vaishali ma'am, for giving us the opportunity for SymbiCare induction program, and all the best to all my students. And we wish good day to everyone.
Thank you, Dr. Alka. I would like to share the screen at this point. Once again, I would like to take you through the introduction gradually as we progress through this program. Dr. Alka Chandak, who made a wonderful presentation about the facilities at the Healthcare Center. She is the director of the Symbiosis Center of Healthcare. She's been awarded PhD under Faculty of Health and Biomedical Sciences in Students' Health Insurance Program by SIU. Multi-site operations of Health and Recreation Center, expertise in analysis, developing and maintaining standards, healthcare programs and process for services. She has wonderful leadership skills and is a member of various health associations. Thank you once again, Dr. Alka.
Thank you.
And
Thank you so much.
this is the team of HCHC, Dr. Ketki Vashikar, Dr. Abhishek Moghe, Dr. Kiran Mahajan, and Dr. Girish Bajaj support ably this entire effort of HCHC. Thank you once again. We now move on to the next presentation by Dr. Nimkar. May I introduce her once again, Dr. Naina Nimkar, Professor and Director of Symbiosis School of Sports Sciences. Apart from her doctorate, she holds 3 master's degrees from Pune University and has also completed 5 credits in MS in sports from Springfield University, Massachusetts in the USA. She has worked on several national committees like the Steering Committee for Sports in the 11th and 12th Planning Commission, Government of India, the Task Force Committee for GOI, that is Government of India, for Sports, NAC and NCT as peer committee member. She has represented India on professional bodies like Access Asian Council for Exercise and Sports Sciences and NAPESS. I'm really happy to have Dr. Naina Nimkar make a presentation to you. Welcome, Dr. Nimkar.
Thank you. So thank you so very much, Dundre Madam, and a very good afternoon to all the esteemed speakers for today. Am I audible?
Yes. Yes, you are. Please continue.
Okay. So a very, very warm welcome to all the students. It's really unfortunate that we're not meeting physically, but there's lots of fun and lots of zeal. I think let's not talk. We all know how important fitness is, and we are all here to help you in that journey. So I'd like to start my presentation with a video that covers all the activities that we do, and then we'll go into the details. Can I have the video, please? These are all the competitions. Yeah.
You ready?
Lovely infrastructure.
Let's go.
Fitness for run.
Yeah. For those of you that want to know what we're all about, it's like this, y'all. This is 10% luck, 50% skill, 15% concentrated power of will, 5% pleasure, 50% pain, and 100% He doesn't need his name up in lights, he just wants to be heard, whether it's the beat of the mic. He feels so unlike everybody else alone, in spite of the fact that some people still think that they know him.
So, if you can see, during the pandemic period, we've gone online. International Day of Yoga.
Yeah, you can be the greatest, you can be the best, you can be the King Kong banging on your chest. You can beat the world, you can beat the war, you can talk the guy, go banging on his door. You can throw your hands up, you can move a mountain, you can break rocks. You could be a master, don't wait for luck. Dedicate yourself, people by yourself. Standing in the Hall of Fame, yeah. And the world's gonna know your name. you can run the mile, you can walk straight through hell with a smile. You could be the hero, you could get the gold.
And we encourage physical activity and walking.
Do it for your people, do it for your pride. You're never gonna know if you never even try.
Last year we had 9,000 participants.
Do it for your name, but there's gonna be a day when you're
really inspiring.
And the world's gonna know your name. And you'll be on the walls of the Hall of Fame. Be a champion. Be a champion. Be a champion.
We have the staff also very actively involved. Walking on Wednesdays.
Politicians be preachers.
This is a Fit India program, walking up the hill.
Astronauts be champions, be truth seekers, be students, be teachers, be politicians, be preachers, be believers, be leaders, be astronauts, be champions, standing in the Hall of Fame. Fitness Godos! Honor and Godos! Fitness Godos! Honor and Godos!
We also had the chess competition online.
And the world's gonna know your name. And you'll be on the walls of the Hall of Fame. You can go the distance, you can run the mile, you can walk straight through hell with a smile. You could be the hero, you could get the gold. Breaking all the records they thought never could be broke. Yeah, do it for your people, do it for your pride. You're never gonna know if you never even try. Do it for your country, do it for your name. Cause there's gonna be a day when you're standing in the Hall of Fame. And the world's gonna know your name. Cause you burn with the bright flame. And the world's gonna know your name. And you'll be on the walls of the Hall of Fame. Be a champion. Be a champion. Be a champion. Be a champion. On the Hall of Fame. Be students, be teachers, be politicians, be preachers. Be believers, be leaders, be.
So thank you so very much. Can I have the presentation, please? You would see the lovely activities that we've had all through the year. I think the corona has made us more active than earlier. Let's understand a little bit about the department. This is the Department of Sports, Recreation and Wellness. And this was, the head office is at Lovely. So what happens is you have the Symbiosis International University, which is, we call our department the DSRW. There are two basic wings to this department. One is the sports and one is the recreation and wellness. Under the sports head, we have inter-institute competitions and inter-university competitions. Now, what happens is this year, I mean, due to the corona, we've also had intra-campus. This is something that we've added. Now, we also provide for sports scholarship, which are roughly 5 scholarships a year. They've been on hold for the last 2 years because there's hardly anybody participating. We have credit programs and value-added programs. Let me tell you, the undergraduates have a Fitness for Life mandatory program, which I'll be telling you a little bit towards the end. There are different clubs which are there on campuses. These clubs could be running, walking, volleyball, basketball, and so on and so forth. And we have lovely mass activities. I'd like to tell you that we have all these that have been written here. The International Day of Yoga, the Fitness for Freedom Run on the 25th. We have Symbiton, which is an online walking event held from the 29th of September to the 10th of October. We have SymbiFit, which is a challenge for fitness freaks. We also have something like the Happy Healthy Campus, which is all fun. It's like the, Happy Streets Pune. And we have outbound activities which will challenge you, and these activities which get you together as a team. We have some lovely other innovative activities. For example, you can have a fitness date. I think that would be very interesting for all of you. We have Mr. Wasim Khan, he's one of your sports officers. If he's extremely fit, you want to have a date with him on fitness, that could happen. There are different kinds of challenges. There is stair snacking. You know, you could use the stairs to actually improve your cardiovascular fitness. There's so many things that one could do. These are two important things. We have activity breaks, we have Wednesday walks. There are lots of things. Something new coming up, maybe just breathe symbiosis. I want to tell you, each one of us, you know, in under Corona, in these times now, we must learn how to breathe, friends. And if we can do that just for 5-10 minutes a day, breathing is important. So this Just Breathe program would be just coming. I just need to get a mandate okay from the top, and then we should be starting with it. We will begin your day with breathing activities and also the ability to sit still. You know, sitting still, very important. Can we sit still for about 2 minutes? We need to check. We need to bring out all that stress from our bodies and be fit for life. So this is about sports. Now, in the recreation and wellness wing, we have fitness testing, which is mandatory across for every student. During the pandemic, we've had online fitness. So you take your own videos, and I'm requesting all of you to please do this because you really need to know how fit you are. I don't know whether you really do that, because when we've seen some students come back during this pandemic, we found them to have put on weight. I mean, naturally, because you've not been going out, you didn't have an opportunity. But there are many things that you can do at home, and this entire fitness team will be helping you there. We have gyms on campus, but our team will also assist you in case you need personal training at home. There could be, we have trained, well-trained, certified instructors who will help you at home also. Similarly, in yoga, we have stress management programs. We have yoga to keep you flexible and agile. See, yoga will also make your mind agile, and that is very, very important, and also make you, you know, a little more centered, which is required today. Are we running in all directions? Today, we need to center ourselves. So aerobic, Zumba are on. These are online activities which are still taking place. So when you come on campus, all this will be available on campus. But right now, all of this is available online. So all our instructors and everybody would be online, and all this instruction and this information is given to your administrative officers and also to your sports council. Can we have the next slide, please? So if you see the competitions, of course, the competitions are on hold now. This is what will happen next year. So you have inter-institute competitions, and then you have selection trials out of them. We select students, and then there is a coaching camp for these students. So at most probably in Lovely or Vimannagar, wherever these coaching camps happen, people who are in off campuses would come and stay here, and we will be giving you a DA, we'll be giving you your jerseys and things like that. They're good coaches who come and coach you, and then you represent Symbiosis International University in the inter-university competitions. So that is something very important. And there are several activities. There are 22 different activities in which we take part. So now what all do we do for inter-university? We provide you with an attire which includes the normal. Your attendance is taken care of. So please don't think that if you come in for the coaching camp, your attendance is going to get affected. That will be counted. We will give you a certificate for the number of days you've been with us. Exams, in case you go for UGC tournaments, I mean the AIU tournaments, the university tournaments, then you can apply, or if you want to go for any international tournament or maybe a national tournament, you could apply to us, and if we find that correct, then we will request the exam department to reschedule the examination. Okay. Then we also have, I'll get to your question a little later, right? We provide you TAD and also a scholarship. Yes, you are allowed to use facilities across in that campus. It's not that a campus has facilities only for one institute. The common facilities are there for everybody to use. Okay, can I have the next slide? Yes, can I have the next? Yeah. So this is your output. Now, all of you, if you want to enroll in the gym, there is a procedure for doing this. Of course, all what you see on the left-hand side, I think all of you know. You need to give your medical history with the medical officer of HCHC, and you have to fill a form of DSRW. There will be a fitness test that is conducted. You will have to accept the code of conduct, and then we'll welcome you to this new era of wellness. So what we're trying to tell you is, yes, I read something here. We were denied. What were you denied? Can I just see that? Just a minute. Yeah. we were denied entry into. Okay. So I don't see any reason why that should happen. So normally, if you are at the hill base, you have hill-based gymnasiums, so you could come. But if you want to play cricket or something, you are welcome up on the Hilltop campus. But the point is, because of Corona right now and the pandemic, they have denied entry right now. It is because of the Corona conduct, the code of conduct. But I will definitely have a word with the campus administrators, and we will tell you. No, when you represent SIU, you don't have to pay money for the sport wear. We will be giving you, but when you go into the gym, that is something that you will have to do yourself. So TK, what if you see here, we are at home or things like that, what do we do? Can I go to the next slide, please? Can I go to the next slide? Next, you've gone back. Can we go ahead? Yeah. So now if you see, we are virtual, as I've already told you, are virtual in most of the things. So we would request you to actually, connect. Your AO will be sending you emails, and you can enroll in the various different activities that are there. Now for you right now, virtually, what is on currently is the Azadi Ka Amrit Mahotsav, under which we are doing Surya Namaskars for 21 days. Please do enroll, because all this data is going to go to the Government of India. We would be conducting walkathons and cyclothons. We'll get information about that. You can have your SymbiFit is an event which will be coming up next week, next month in February. You'll get details about that. It is required that you are fit, you don't have to, if you had COVID, you will not be able to participate. So those rules and regulations are something that we will get to you. Yes, go next. Can I go next, please? Next slide. So all this is there, the fitness tests, the challenges, the fitness sessions, value-added courses, yoga sessions, and outbound activities. Can I have your next, please? Can I go next? Go to the next slide. So how do we connect? So you, in the institute, you have students, faculty, and staff, which form a sports council. Okay, and the sports council and the ADPS means the Assistant Director of Physical Education and Sports, or the sports officers and the senior in charges of the gyms. So that is the connection that you have. Okay, this is how you're connected. So I need that the sports council is very, very active, so that the information reaches there, and through them, all of you can take part. Yes, next. Can we go to the next slide? Yeah, so this is the constitution. You need not know. As mentioned by Dr. Alka, we also have OMPI, which means your participation in the different events that we conduct. It's inter-institute, or the virtual, or the varsity, or state national events, fitness test score, and the gym attendance score. Basically, how active you are and how many of you actually take part in all the events. And if you have any national representation or state, national, international representation, that also is counted here. Yes, can we go next? Now, contact details are there. If you could download the SymbiCare app, as mentioned by Dr. Alka, I'm sure you will get all this information, and who you need to connect for your sports requirements is all there. We have a very, very active sports department, and they will address all your needs. Yes, can I go next, please? So these are the contact details. You can take a screenshot, or you could take a photograph and keep it, or we can send this all to you. We will send this and share this with you. Can I go ahead? Yes, can I go ahead? Now, this is really my team, and we just have the 7-8 members of us who are looking after all of Symbiosis. And let me tell you what is important, I feel, is that we have beautiful bodies. I think I'm just appealing to you, just look after it, get into the habit. Just walking 7,500 steps. I'm just appealing to all of you. Forget what you have to do. We have a Fitness for Life program, which is mandatory, which will make you walk, run, give you all the information and sensitize. What is important? It's your body. Look after it. You look after your car, you look after your vehicles, you look after your laptops, your pens, your phones, and everything. This lovely body, it will, if you have a fit body, you will be able to achieve all the dreams that you have. It's better, that you die, the quality of life. kind of things that you want to do. And we are there to help you. That's what we're saying. There's something in the chat box. Yes, when the college reopens, everything will be, the gyms are accessible. Yes, they are. Right now also the gyms are open. So if you are on campus, like some placement committee members and all are there, the gym is accessible, but you will have to go through that process. That is important. So I just want you to respect your body. I want you to be fit and fine. And please breathe, whether we take the Just Breathe program or not. Friends, breathe for 5 minutes. Listen to your breath. Keep well. All the best. Thank you so much.
Thank you so much for a wonderful presentation, Dr. Naina. Such a vivacious presence on screen. So let me again share the screen for you to for the people to see your lovely team here.
Yes.
So Ms. Shweta Sharma, who heads the Department of Sports, Recreation and Wellness, I know her for a very cheerful, presence there with people. Similarly, we have Ms. Anthony Augustine, Ms. Belua, who takes us around on the Wednesday walks.
Beulah. She's called Beulah.
She's Vimla. Oh,
Beulah.
Beulah. Thank you for correcting me. Mr. Nirmal and Mr. Wasim Khan. So we look forward to more and more dates with Mr. Khan for fitness, right? And now let's move on to the next presentation. I invite Dr. Girija Mahale to make a presentation about the Symbiosis Center for Wellness, Emotional Well-Being. Over to you, Dr. Mahale.
Yes, thank you, Dr. Vaishali. Can I please ask the IT team to share our PPT, please? So very good afternoon to all those who have joined us virtually for the SymbiCare induction. Although we are quite late in conducting this orientation, better late than sorry. So, it's good, in fact, that we are conducting this SymbiCare induction a little late after you all have settled into your academics. And although you all are attending everything online, it's important that you're aware of all the facilities that are present for you for student support. So I head the Symbiosis Center for Emotional Wellbeing, and I'll be taking you through what mental health support is available for all students across SIU. And why is it so important to look at mental health, particularly in the current times of the pandemic, is what I will share with you today in our talk. Firstly, I'd like to take you through a video which will share how SCW came into being and what is its purpose. So if I can ask the IT team to play the video, please. The second slide is the video, Praveen. Praveen, are you having some? The second slide is the video.
Is it hyperlinked, ma'am?
No, it directly plays.
Okay.
Should I try from my end?
Just 1 minute, madam. I'm checking.
Okay.
Ma'am, I will request if you have PPT, can you share? Here it is
Sure.
not working. Yeah.
Sure. Is it audible and visible?
It's not audible, it's visible.
Just a minute. So I think I'll have to.
Ma'am, you just reshare. Stop sharing and reshare and click those two boxes while sharing. Share the sound and optimize video.
Share sound.
Now share once again, ma'am.
Yes.
And click those stick box.
And recognize the importance
Is
of
it audible
emotional well.
now?
Yes, ma'am. You can play from start now.
Okay. Oh God.
Mental health is an essential part of ensuring well-being due to its widespread impact in different facets of one's life. Honorable Dr. S.B. Muzumdar Sir, the founder and chancellor of Symbiosis International University, became aware of the various challenges faced by the student community and recognized the importance of emotional well-being at the university level. His vision took shape in the form of the Symbiosis Center for Emotional Well-being, or SCEW, which was established in August 2018. Under the able leadership and guidance of Dr. Vidya Yerodekar, Pro-Chancellor and Principal Director of SIU, and Dr. Rajiv Yerodekar, the Dean of Faculty of Health Sciences, SCEW was established to meet the mental health needs of the Symbiosis community.
Given the rising incidence of mental disorders amongst the population at large, especially amongst our younger population, and India is a young country, the pivotal role of higher educational institutes in addressing the same, mitigating the same, and preventing their escalation to serious proportions, Symbiosis International University has taken this pioneering initiative of establishing a Symbiosis Center for Emotional Well-being on campus at the university. We thought of having a three-pronged strategy to address these mental issues. One is destigmatize the entire approach. Two, educationalize the approach towards looking at the mental health problems. And the third point is to demedicinalize the approach in the sense that only doctors need not be involved in the treatment. There could be a team of doctors, psychiatrists, general practitioners, counselors, medical social workers, mental health nurses, and the family to address and mitigate these mental health problems.
The team is led by their head, Dr. Girija Mahale, a renowned psychiatrist who has worked extensively with the youth population.
The center that we have set up here has a youth-friendly approach with easy accessibility and approachability to mental health services with on-site campus counselors. The services that the center offers are holistic in nature, integrated, and are very much client-centric. Over the last 2 years, we have set up standardized protocols for triage, assessment, and interventions with a feedback process in place, with outcome tools that ensures quality of services that we offer. I must say that over the last 2 years, it has been a truly enriching and satisfying experience, providing services to hundreds of students, varied kinds of interventions using counseling, various therapies such as mindfulness-based practices, cognitive behavior therapy, arts-based therapy, and even psychiatric interventions where necessary. The best part is the trust that we have gained, not only in students, but also the faculty and the management. And I can proudly say that students now have no hesitation in approaching us for the slightest of mental health difficulties that they encounter. I am very grateful to Symbiosis management for entrusting me with this responsibility, and I assure to continue to thrive to develop this center further in terms of establishing innovative academic programs and conducting immaculate research.
So the approach at Symbiosis is a totally new approach, befitting the stature of a university, given the diversity of students and faculty on campus of the university. Thank you.
SCEW aims to bridge the gap in mental health care, cultivate resilience, and educate the youth. Our counseling spaces offer privacy, comfort, confidentiality, and a sense of security for our clients. The SCEW team comprises of diverse and skilled mental health practitioners placed across the various campuses of SIU. Psychiatric consultation is also provided if needed. To ensure extensive outreach, the team conducts various awareness drives and workshops for all stakeholders. Through the pandemic, SCEW has launched telecounseling services to maximize connectivity and outreach, thus ensuring continued mental health support. We firmly believe that a strong and healthy foundation is key to an emotionally and mentally sound community and society at large. With each passing day, we take pride in working towards that goal.
Thank you for being so patient. Sorry about the technical delays. Okay, so here's the team. We do have a campus counselor at every campus. So all the institutes that are placed at a particular campus reach out to our campus counselor through an email address that I'll be providing at the end of this PowerPoint presentation. And you can reach out for individual counseling as well as for psychiatric services if required. All these are free of cost. It's covered in your tuition fee. So you don't have to pay anything extra for any of the counseling services that you require. Now, why is mental health so very important? Yes, it's the pandemic, and I guess everyone has felt how it has affected and seen how personally it has affected their own mental health. But particularly for you students, you all are what, 17, 18, and you all are going through a significant transition, which is from adolescent to young adulthood. And this transition in itself is a big challenge, which makes you vulnerable for mental health difficulties. The whole social milieu, the changes that you are going to encounter through this transition of developing new relationships, whether it's peer relationships or romantic relationships. You all are now entering into a professional career life with starting your journey through undergraduate program and then probably proceeding through postgraduate programs as well. So it's a huge transition from school to college. In terms of your psychological growth as well, you're now becoming more autonomous, more independent, establishing your identity. And that in itself can be a challenging process, especially given the lack of social connections through this pandemic. And of course, health-wise, physical health-wise also, this pandemic has made us look and reflect on our physical health as well, which is so very vital. So it's very, very pertinent that you understand your mental health, you're able to identify the signs and symptoms of distress. And I believe many of you may be already familiar with your campus counselor, and you may even have had a classroom induction. If not, we will be approaching your individual institutes for conducting a classroom induction, which will orient you to understand what emotional well-being is all about, and how can I really identify whether I'm experiencing any mental health difficulties, and what are some of the simple practical things that I can do for myself. Like if you heard Dr. Naina, she had some wonderful ways in which you can rejuvenate your body. And there are equally important and effective techniques in which you can rejuvenate your mind as well. Because through this pandemic, we have realized that, initially when the lockdown was announced, we were all kind of relaxed. We felt, okay, we all got a break from, attending physical classes. But then as the pandemic proceeded and as the lockdown continued, it became a very monotonous life, sitting in front of the screen, not having space to connect with your friends, led to a lot of emotional health issues. Some of them, large number of students we saw that lost their tendency, lost their ability to focus or concentrate. And a large number of students lost their motivation to study, getting easily distracted, even developing things like anxiety, where they had difficulty interacting with their peers, even on an online platform, were exacerbated during this pandemic. So overall, we found that the levels of distress among students and equally among the faculty, because even transitioning from offline classes to online classes was a challenge for the faculty as well, was an overlying distressing experience. And therefore, SCEW thought of developing a number of webinars and conducting group therapy sessions as well as for students. So during the pandemic, we did have Mind Katta, which were group therapy and support groups for students at their respective campuses through via their campus counselors, as well as we had a range of newsletters that we shared with all the students, which gave sort of snippets about how you can cope in the current times, focusing on different aspects of the pandemic itself. Now, the most recent thing that we have launched is the Mental Health Championship Program. I think some of you may have already volunteered for it, and we've already chosen, and there are about 50, I'm glad to share that we have about 50 mental health champions for this year, whom we will be training throughout the year in terms of identifying their peers who do suffer with any or who are exhibiting or expressing any mental health difficulties. We'll be training them with psychological first aid training. We'll be helping them to develop their EQ, that is their emotional intelligence, through EQ training workshops, and also sensitizing them with various common mental health conditions like anxiety and depression. And so this is being done in order to involve students in their own mental health and to have their own representation in terms of taking their leadership for their own mental health. So all the webinars and workshops, we are going to be involving these mental health champions who can share what students actually need, what are the problems that they're going through, what are the challenges that they're facing in their mental health. And through this next year, we want to conduct workshops which will actually target your needs and be able to provide you with certain solutions for the same. So if you want to reach out for individual sessions, then definitely reach out to us. This is you can take a screenshot of this screen, this slide. To reach out to us, write to us on mindhelp@siu.edu.in. And after which, your campus counselor, what you need to mention in this email is your name, your institute, and your PRN number, because that will help us to identify which campus you belong to. Once we receive your email, the campus counselor will write back to you and you will be sent a link to 3 forms. Now, this process is essential because this allows the campus counselor to understand the basic nature of your problem, and it also ensures that you're consenting for this process and that we are able to provide you a confidential space to share your emotional health issues. And then you'll be given a date and time for that counseling session. If students are on campus, we are able to provide you with face-to-face sessions. If you all are still in your hometown, then online teletherapy sessions are also available. Then, of course, the counselor will sort of take about 1.5 hours for the initial intake session, after which they will schedule your follow-up sessions and so on. If you require any help with academics because of your mental health problems, we are able to also collaborate with faculty and your director to provide you assistance for the same. So my really takeaway for this is, if you're suffering, do not hesitate to reach out to us. We ensure to be keeping complete confidentiality, and my young team members will definitely help you come up with solutions, and we can collaboratively work through your problems. I wish you all the best, and I hope to see you all soon on campus for more interactive face-to-face sessions, which are definitely much more effective than online sessions. Thank you so much. Thank you, Dr. Vaishali, and all the best.
Thank you for such a meaningful, session, Dr. Mahale. Just to take the students round through again a round of introduction, I would like to share this slide with them. Okay. Ho gaya? Can you see the slide? Okay, hold on for a minute. I need to share the slide. Yeah. Yes. So thanks for this wonderful introduction to SKU. Students, just a glimpse of her personality. You've already seen how pleasantly she's addressed to so many issues. So far as mental health is concerned, she's a consultant psychiatrist. She specializes in youth mental health. She's a fellow of Royal Australian and New Zealand College of Psychiatry and instrumental in selecting a team of counselors for various campuses. More than 20,000 cases were handled in the pandemic period by this center. And this is really a proud thing to share. More than 1,600 counseling sessions were conducted in the year 2021. Okay, so now we move on to the next presentation by Dr. Natarajan. I invite him to make a presentation. Before he does that, let me introduce Dr. Natarajan. Dr. Vijay Natarajan is the CEO of the Symbiosis University Hospital and Research Center. He is a medical graduate from the BJ Medical College of Pune, the very prestigious college, a gold medalist in general surgery, Pune University, Australian and American qualified cardiac surgeon, MBA in healthcare management from BITS Pilani, and in private practice since 20 plus years. We are indeed proud to have you as the CEO of SUHRC, sir. I invite you to make your presentation. Thank you.
Thank you very much, Vaishali, for your very kind introduction. You will take the mask off. I hope I'm audible.
Yes, you are.
So, yeah, thank you. So, to all the students here, good afternoon and welcome to the Symbiosis family. At the outset, I'd like to congratulate each one of you of having got into your respective courses, beating a lot of competition in the process and making it here to the prestigious university. So congratulations and welcome again. As far as the hospital goes, we'll just show you a little video that gives you a brief introduction to the services that we have at the hospital, and then I'll make my equally brief presentation after that. So if we could just have that video about the Symbiosis University Hospital and Research Center, please. Thank you.
Away from the hustle bustle of Pune, in the quieter environment of Lavre, stands the majestic campus of Symbiosis University Hospital and Research Center, SUHRC, a retreat hospital. Sprawled over 40 acres, the hospital campus houses an 866-bedded multi-speciality hospital with over 20 specialties. For over 50 years, Symbiosis has been imparting quality education to students across the globe. Drawing strength from this trust, Symbiosis University Hospital aims to redefine healthcare in Pune through its evidence-based clinical care, taking forward the philosophy of Vasudhaiv Kutumbakam. The world is one family. SUHRC believes in inclusiveness across all strata.
At the Symbiosis University Hospital, our goal is to provide the best of patient care through our team of well-trained healthcare professionals, supported by the latest technology and excellent infrastructure.
We have specialists in cardiology, nephrology, neurology, gastroenterology, and other surgical specialties. SUHRC offers comprehensive care to patients through a full spectrum of medical and surgical services with the latest state-of-art equipment. At Symbiosis University Hospital, our endeavor is to send back happy patients by creating a homely environment by going beyond the call of our duty and thus have happy faces, smiling faces at home and in the hospital as well. At SUHRC, healthcare goes beyond infrastructure and facilities. We make qualitative difference to one's life and health through patient-centric approach. It is beyond call of duty for all of us. SUHRC, one family, one hospital.
Yeah, thank you for that. So as they say, a picture is worth 1,000 words, and a video is probably worth 100,000 words. So I'm sure you've got a brief idea of what the Symbiosis University Hospital and Research Center is all about. And I just want to say that I would like you to visit the hospital not as a patient, but just for the sake of looking at what the hospital, more like a tourist, and just take a look around and see, whatever facilities are here, and also give us your inputs on how we can actually make things better in the rare chance of you actually needing to come to the hospital for medical services. We've got all the specialties, both basic and super specialties here. So as I said, it's not something that we look forward to having you here as a patient, but if you do need medical care of any sort, we'll be here 24/7. This is something I'm sure should be reassuring for your parents who are obviously going to be very concerned about your health. And in the event of you falling ill, they would like to be reassured that they are in safe hands, that their most precious belonging is in safe hands. In the current flavor of the season, which is COVID, there's nothing to fear in that sense, that at least the current wave, as you all know, is a relatively mild wave, but still there are some who do get complicated and serious. In this context, we've treated over 6,000 patients in the first and second wave, so we have a fair bit of experience. So in the rare and outside chance, if any of you were to need hospitalization for COVID, we are fully geared up, and my team will provide the best of care in that context too. As I said, COVID again is something which each of us has to be aware of. You are already familiar with what is considered as COVID appropriate behavior, but on the campuses as well, we expect, at least till this whole situation cools off, we would expect you to be wearing masks when you're outside, and hopefully you will have completed your primary vaccination schedule, which is 2 doses. And as and when the government announces the need for a booster dose, what they're currently calling precautionary dose for your age group as well, then hopefully you should be able to take that. Keeping hands clean is something which is part of basic hygiene, but more so in a COVID context. I'm sure you're aware of that. And I'm mentioning distancing last because looking at the way students function, that seems more like a utopian dream. But that would be my request as well. As far as the hospital admission is concerned, if you were to need that, I'm sure Dr. Alka has already spoken to you in details about how the Symbiosis Center for Healthcare coordinates that whole activity. Each of you all are already covered to a certain amount by health insurance. So as in when you do need admission, you don't have to worry about any payments or anything like that. All that is already taken care of. Of course, these services are not available to off-campus centers for geographical reasons, which you understand. But one service is certainly available, which is our telehealth and telemedicine services, which we've launched in the last few months. So the details of that are available on the website. And at any time, if you need any kind of consult, you just need to register on that and send in your message, and we'll facilitate the relevant specialist to interact with you as soon as possible. So that option also exists. So overall, I just want to reassure you that in the event of you needing any kind of healthcare, we are here to take care of you. As I said previously as well, I don't really look forward to having you on the campus as patients, but more as tourists. So that's my request again. So, and I also look forward to interacting with you when you come here on the campus, and maybe we might even hire some of you in the relevant specialties, whether it is management, whether it is health sciences. And I'm sure I can assure you that you would have a good time when you come here, not as a patient, but just as a visitor. So once again, welcome to Symbiosis. Congratulations for being here, and take care. Thank you.
Thank you, Dr. Natarajan. And I must say that a visit to the SUHRC campus is actually a must for every one of us, because it's a state-of-the-art facility that Symbiosis has provided. Thank you once again. Well, we move on to the last presentation of this session today, and that is the Student Affairs Department. I head the Student Affairs Department of Symbiosis University. And here I would like to also introduce you to my team of Student Affairs. We have Ms. Supriya Kutti, who is the section officer, Mr. Milind Joshi, who is the senior coordinator, and Mr. Dhairyashil Jagdai, who is the supervisor, administration department, and takes care of the scholarships. So I'm going to request my team to make a brief presentation about some portfolios which will help you understand the student affairs in more detail. So over to you, Milind.
Hello, good afternoon, students. Hello, good afternoon, students. I'm here to brief you the basic information about scholarships. First of all, we here having merit scholarship for semester toppers for the exam season October. This would be for semester 1, 3, 5, and 7, etc.
Ask Praveen to share the PPT.
Hello, Mr. Praveen sir. Could you please share the PPT?
Next slide, please. The next slide. Yeah.
Yes. Sorry. Let me start again. We have merit scholarship for semester toppers for the exam season October. This would be for semester 1, 3, 5, and 7. And for the exam season April, this would be for semester 2, 4, 6, 8, etc. For the post-graduation, this will be based on academic excellence with minimum GPA of 7.50. And for undergraduation, this will be with minimum GPA of 8.50. So there will be another merit scholarship for IIT graduates who will be joining MBA programs at SIU. Next, for sports achievers, there is SIU Sports Scholarship. As earlier, you must have seen earlier presentation. 5 numbers are there for for sports scholarship. Then late Jayati Deshmukh Scholarship is there for SNAP state female toppers. After this, we are having a merit scholarship scheme for the toppers, for the eligible students from Northeast region. That is called NER scholarship, applicable to engineering students, health and biological sciences, computer studies, media, communication, and design students or design faculties. This is, in total numbers, these are for PG, like 2 numbers are there, and for UG, 8 numbers are there. Total 10 numbers are of the scholarships are available. Then there is Dr. Anandi Gopal Scholarship, 5 female toppers of NEET and other exams who secure admissions to MBBS programs at SMCW Institute. Then there are Chancellor's Gold Medal for Best Outgoing Student, both for PG and UG, and another Chancellor's Gold Medal for Best Outgoing International Student, same for both PG and UG. Then there is Nani A. Palkiwala Gold Medal Award for the topper in LLM. This is applicable to SLS Pune Institute. Then late Jayati Deshmukh Best Outgoing Girl Student Award. Then late Satpal Malhotra Gold Medal for Excellence in Business Management. Then Chetan Dattaji Gaikwad Gold Medal, topper in BTech Civil Engineering, applicable to SIT Institute. Then late Daji Kaka Gadir Gold Medal, topper in MBA IB. Then IB means International Business at SIIB. And then late M.S. Pillai Award to students from SCMHRD, nominated from SCMHRD.
Mute kar. I really wish that all students try their best to, be nominated for these awards in times to come. All the best to you. We wish to see you do your, education in flying colors. I now invite my colleague Dhairyashil Jagdale to talk about the scholarships that are offered on the national and the state level. Over to you, Dhairyashil.
Good afternoon to all of you. I am very happy to tell you, SIU has taken a great initiative to provide scholarships to our students. Under the huge umbrella of the scholarship for students, we have successfully registered all our constituents to National Scholarship Portal and State Scholarship Portal, as also the Union Territories. In the last academic year, our students have already received more than 1.5 CR for different scholarships, just like as a National Scholarship Portal and same state and also Union Territories.
Slide change.
Please change the slide.
So next.
Next slide.
Next. Thank you. Apart from the scholarships, we also have taken initiatives to get the students' loan, which is called as Student Credit Card Scheme. There are 2 schemes we have initiated already. One from West Bengal Student Credit Card Scheme, and second is the Bihar Student Credit Card Scheme. For West Bengal Student Credit Card Scheme, West Bengal government has provided 10 lakh rupees to West Bengal domiciled students, and the Bihar government has provided 4 lakh rupees for 1% for girl students and differently abled students, and 4% for boy students. I request you all of you to know that the special nodal officers have been appointed for both scholarships and loans to help the students as a single point of contact. Thank you so much.
Thank you, Dhairyashil. Dear students, please note that you can approach the nodal officers at your campus anytime to know more about these scholarships. And these scholarships, you can nominate yourselves by visiting these National Scholarship Portal and the State Scholarship Portal. These will be intimated to you by your nodal officers time and again through emails. So please keep in touch with the nodal officers at the campus level. Thank you. I now move on to the next and the final part of our presentation, and I invite Supriya Kutti, my colleague, to talk a little about the Code of Conduct.
Good afternoon, students. To maintain discipline in campuses of Symbiosis, we have Code of Conduct in place. All students must abide by the rules and regulations of the Code of Conduct. Next slide.
Next slide. Say loudly.
We have committees under Symbiosis University, like anti-ragging committee, anti-ragging squad, monitoring cell, Then we have campus grievance, student grievance redressal committee, campus disciplinary committee, central disciplinary committee. Next slide. We have internal committees, gender sensitization committee, internal committee for differently abled students, anti-discrimination cell, SC/ST cell, minority cell. Next slide.
Right.
Thank you.
Well, you've just got a glimpse of the various committees that are functional at the university level. You can see that the anti-ragging helpline number is always available 24 hours, and in case you need to approach, you can call on this number. There's a very systematic layout of committees and squads to help students on campus. But fortunately, very less number of anti-ragging cases have happened at SIU, and I really wish the same ever after. Next slide, please. The Student Grievance Redressal Committee talks about or addresses various problems that the students might have so far as the admission process is concerned, or some mentions that take place at the prospectus level or the website updation is concerned. The students can address this as their grievances and seek clarification about different matters brought up in the prospectus and the website. You can also talk about the examination or some problems related to exams so far as the grievances are concerned. Unfair evaluation also comes in as a part of the same. The next slide, please. The disciplinary committee covers various kinds of misconducts, and you can see the list of misconducts that come under these. Start with academic misconduct, like cheating in the exams, plagiarism, disruptive conduct. Then we move on to discrimination or falsification, refusal to identity. Then we move on to more serious problems like, possession or use of weapons, drug, alcohol, smoking on campus, possession or use of property, or illegal possession or use of property and facilities. Next slide, please. These are some more kinds of behavior which is not permissible. Let me tell you, Symbiosis is a no tolerance or zero tolerance university, and we do not at all entertain any kind of misconduct. Next, please. You can see the other committees which are very important, and you must keep a note of these committees as well. For example, the internal committee takes care of the prevention, prohibition, and redressal of sexual harassment of women employees and students, and various other committees that address different subjects important to student life on campus. Next slide, please. I don't need to tell you that if there is a code of conduct that the university defines, there is a set of punishments that go hand in hand with the same. We really wish that this doesn't take place often. Of course, students would be tempted to, take up chances of different kinds, but I would suggest that you take a chance to win medals and scholarships more than taking a chance of being invited to talk about a misconduct on campus. You can see that there are different kinds of defined punishments for different kinds of misconducts. Please, the next slide. Yes, you can know more about all these rules and regulations on our website. You can see the address of this, the https://siu.edu.in student affairs, where all these mandatory disclosures are given in detail, so that you get an idea about how not to indulge in such behaviors. Next, please. Of course, I would say once again, I would appeal to all of you that please indulge in all the wonderful activities that have been shared so far by all my colleagues. There's a lot of sport, there's a lot of academics, there's immense activity that SIU would provide you to indulge in. So please be engaged positively. Please challenge your capacities to give your best rather than getting engaged or indulged in something that would bring disgrace to yourself, to your university, and to your family. I wish you all the best. for your stay at Symbiosis. I really wish all of you come soon on campus and we meet each other, more often. We will, as Student Affairs, I will also be sending you a lot of information so far as scholarships, so far as activities, and UGC kind of activities are concerned. You will keep getting emails from us. So stay in touch, and more, you can have these contact details with you. We are going to share this entire presentation with you on email. So you don't need to actually take down anything. You will receive this video and you can refer to these contact details whenever you require. So I wish you all the best. Thank you so much. Next slide is a big thank you on behalf of all of us here, on the 5 heads that have made their presentation. And for more questions, you can always get in touch with us through the contact details that we have provided. So I once again request my colleague Supriya to give the vote of thanks.
Very good afternoon to one and all. On this wonderful afternoon, I, Supriya, would like to present. Okay, a very good afternoon to one and all. On this wonderful afternoon, I, Supriya, would like to present the vote of thanks on behalf of SymbiCare. I would like to thank the chairperson of the session, Dr. Rajiv Jaravdekar, Dean, Faculty of Health Sciences, for accepting our invitation to address students of all the UG batches of 21-22. I would like to thank our speakers of the day, Dr. Alka Chandak, SymbiCare Center for Healthcare, Dr. Naina Nimkar, Department of Sports, Recreation and Wellness, Dr. Gija Mahale, SymbiCare Center for Emotional Well-being, Dr. Vijay Natarajan, SymbiCare University Hospital and Research Center, and last but not the least, Dr. Vaishali Jondre, Head Student Affairs. Thanks to all the respective team members of all these departments. I would like to thank the SymbiCare IT team for coordinating this online session. Thanks to all the faculty and staff of all constituents for encouraging students to attend the SymbiCare session. Special thanks to our Honorable Vice Chancellor, Dr. Rajni Gupta Madam, and Registrar Sir, Dr. Shejul, and management for their support. Thank you, dear students, for your participation and presence. Once again, I thank one and all present here and declare the program over.
Thank you.